Yeah, Shep, good to be with you. My message to them is simple. This is going to be the key to never worrying about your child being hospitalized or dying. The efficacy, the effectiveness, Shep, simply put, right, is exactly on par with adults. And it confirms what we knew, that children above the age of 12 actually have the same risks of transmission and infection as adults do. So to any parent like myself, like anyone out there who worries about their children's health, this could be the shot series that guarantees that they can have health in the form of education. You just talked about mental health, all the things we've been worried about. This is finally the first step and hopefully one of the last steps to getting back to normal.
We can hope. Doctor, this is new, to me at least. The governor of South Carolina has now announced he's going to let parents decide whether kids should wear masks in schools. He cites the increased vaccination rates among adults. Are we at that point where kids really don't need to be wearing masks in school, or no?
Yeah, it's a great question. And what we know, here's the disappointment, Shep. All of us in public health are urging the CDC, and you heard President Biden talking about the CDC updating guidance. Without that guidance, you do see what the governor of South Carolina, many other governors and mayors are doing, which is to just do things without evidence or science. The evidence so far tells us that schools can be a source of transmission, and younger children, as we're vaccinating everyone else, Shep, can be a ripe opportunity for the virus to infect other people. And so I do think that indoors, if you have very good circulation and you have a testing strategy, and the teachers are vaccinated and all the staff are vaccinated, there could be a future where you do not need to wear masks. But Shep, we're still wrestling with many educational staff, many healthcare staff, my colleagues, many law enforcement and military personnel who have refused this vaccine. And so until we overcome that, yes, it's safe to be indoors and wear masks no matter what age. And that won't change until we can get to that level of decreasing cases.
In other words, we got to wait just a little bit longer. You know, today, the Senate held a hearing on the country's COVID-19 response. And some of the senators took issue with what they say was conflicting and confusing guidance from CDC. Listen.
I used to have the utmost respect for the guidance from the CDC. I always considered the CDC to be the gold standard. I don't anymore.
The American people are incredibly frustrated. And as Senator Collins says, they're beginning to disregard what you say that's true.
You know, they're not on an island. Are you concerned about the credibility of the public health agencies in our country?
I am. And I say this as a former government official. I think the CDC's credibility is eroding as quickly as our cases of coronavirus are eroding. And Shep, that's not good news, because we do need workplace guidance. We need school guidance. We need everything that you heard President Biden and the governor's conversations talk about. Americans want to know, why do fishermen in Maine and Alaska have to wear masks if they're fully vaccinated? Why are there still Coast Guard rules to follow guidance, to issue citations? There are men and women working on the lines outside on telephone and electricity lines, and they're still wearing masks because we just don't, in the absence of this guidance, Shep, we're making it up, and nobody wants that, because that actually puts more of us at risk. So this is time to step up. These are the hard parts of government and public health communication, but we desperately need someone to do it.
Wow, Dr. Kavita Patel, thank you for your candor. Shepard Smith here. Thanks for watching CNBC on YouTube.